winter chairs under? Or are we going to sit on the
Yeah,
air conditioner?
go
We'll sit
get-
on the air conditioner?
Go grab, just grab those chairs. Oh no, that'll fall off.
Will fall.
Hey,
This one?
can you're live. We're building an audience for you. Okay, everybody, we're struggling here to try to get our seats. Oh, Dr. Nelson's getting our seats. We had a weak connection, so we're very sorry. We're out on the patio of my condo trying to get our seats. So we're just getting ourselves organized. Today is Facebook Live with Dr. Linda of the Vascular Birthmarks Foundation and Dr. Stuart Nelson. Hi, guys. Thank you for tuning in. And it's saying our connection is weak. There's not much that we can do about it. Oh, hi, Julia. Julia Sams saying hi, Dr. Nelson. He'll be here in 1 second. So we're just going to have to do the best we can because this is we're just playing it by ear here. Let's see if we can set this up. I'm just gonna have to hold it.
Okay.
Okay, so hi everybody. Here's Dr. Nelson with me on
evening.
Facebook Live. You have to get over a little closer so
Sorry.
I can see in. Okay.
Does
sorry.
my wife know about this?
So today's topic is vascular birthmarks and laser treatments. I'm going to try to just hang in there with me while I try to set this up so I don't have to hold it through the whole session. And I can then tip it. All right, hang in there. We're working on this. Okay. All right, everybody.
Okay.
We're waiting for your questions to rotate now sideways. It's not turning them sideways. Guess we're gonna have to stay this way. Hi, Corinne and Nicholas. Hi, Tracy. Can we start seeing your questions on treating a port wine stain or a hemangioma with a laser? Dr. Nelson's here with me. Again, we're trying to set this up because we're having a little bit of problems with all of our devices. So let your questions start coming in, saying our connection is weak, but I guess you can see us, right, Corinne? You're saying hi from Seattle, so I'm assuming you can see us. And Dawn, we're just looking for questions to come in on treating a vascular birthmark with a laser. It's saying our connection is weak. But I'm hoping to see some questions come through. We don't have a good internet connection, but okay. Julie Oliver, at what age do you typically see patients to have treatment?
We start treatment as soon as possible. The younger you treat the child, the better the result they'll get in terms of their final outcome.
Should rapamycin be used in conjunction with PDL?
It was our group that introduced the rapamycin, but unfortunately over the large clinical studies we did not find the rapamycin to be helpful. So at least at the moment, we are not currently using rapamycin.
Okay, thank you for that question. Hi, Jody Lee. So let's have more questions on using the pulse dye laser for treating hemangiomas in port wine. We have Dr. Stuart Nelson with us. The email, if you have a question to Dr. Nelson or myself for Dr. Nelson, is birthmark.org/Nelson, and for myself is birthmark.org/Dr. Linda. You're welcome, Heather. Next question, please. Can we see more questions coming through for Dr. Nelson here from the Beckman Laser Institute in Irvine, California, and Dr. Linda from the VBF. We're having to hold this because we're sitting out on a patio to get a good connection. Okay, so we have 10 people. Well, now we have 14. That's the number of people that are on. So let's get those questions coming in. All right, Stephanie, you're in Canada. They allow a maximum of once every 2 months. Do you recommend more often? Your son has Sturge-Weber, port wine on his face. He is 2.
I would say at least in a 2-year-old, at least at the minimum to have that treatment done every 2 months. At least for the infants and children that we're doing now in Irvine, we're trying to treat those infants and young children at the latest every 4 weeks.
So that's your answer. Hi, Jody, and thank you, Missy from VBF, for posting Dr. Nelson's email. Oh, you're doing 2 months in between right now. Daughter is 18 months, started at 2 months, 10 treatments. Should we do more often? We used to do 4 weeks apart.
Well, for the children, the real young infants and children who are less than a year, I would highly recommend that those treatments be done at intervals of about 4 weeks. As the children get older, and perhaps we've seen a plateauing in terms of their fading in response to the laser treatment, then we'll stretch them out to longer periods of time, 2 to 3 months.
Okay, thank you, Stephanie. Dr. Linda again from the Vascular Birthmarks with Dr. Stuart Nelson from the Beckman Laser Institute in California. Remember, if you're coming to our conference in Irvine on October 7th, you can see him. Daughter has a port wine on her upper lip. You've already seen a few pics. Local doctor wants to begin treatment at 1, then followed every 3 months. How do we bring up, I'm assuming you're going to be saying how to bring up the topic that you should start more frequent.
Well, you can certainly go onto the internet and you can download the paper that was published by Roy Geronimus' group from New York that showed that early, aggressive, and frequent treatments done every 4 weeks definitely improves therapeutic outcome.
And that paper is at birthmark.org on our website under medical papers available. Any common side effects? Our daughter is 3 with a port wine stain on her cheek and has debated treatment for fear of side effects, physical or emotional.
Well, for a 3-year-old child, we would do on a day when we had our pediatric anesthesiologist.
Okay. Hopefully we're back on now. We had a pause that we lost ourselves for a second. You can't touch.
Well, you can't see more?
No. Okay. Okay, so Julia, we are only seeing the word why aren't. Joel, I believe you're the one who wrote, and where you're from, they don't do frequent treatments, but you can use that paper that Dr. Nelson mentioned, done by Dr. Geronimus, who is a world-renowned expert in the treatment of port wine stains, that said most effective to have them done every 4 weeks. Okay.
Heather Funk is back.
And this is Dr. Stuart Nelson, one of the top laser experts in the world today, talking about using the pulse dye laser, or any laser for that matter, to treat port wine stains and hemangiomas. We're on Facebook Live for the Vascular Birthmarks Foundation, and we do have a weak connection, so if you lose us, we'll just hang on to get right back. Hi, Mahela Bowen. I'm happy to see you on here, so why don't you go ahead and post your question, Mahela. For Dr. Nelson. Diana, hello everyone. Julie Oliver is cut out when you were responding. Oh, repeat about...
I think we were talking about the 3-year-old. We, as I said, treat those children with anesthesia. With that said, we don't paralyze or intubate the children. We simply mask them. We allow the parents to go into the operating room at the time the child is being put to sleep. We have our child life specialists there at the same time so that they're distracting the child. And we have found that works well and doesn't cause any psychosocial issues for the child.
All right, well, we had 2 questions come in. One is on darker skin. You notice that her laser treatment, sometimes you see a lighter outline of her port wine. Is that related to laser?
Well, the light from the laser will be absorbed by melanin, which is in the most superficial layer of the skin during the laser treatment. That's actually the reason we developed the dynamic cooling device, was to protect the epidermal melanin. But you can lose some melanin immediately after the laser treatment, so it's not unusual to sometimes, particularly in patients with darker skin types, to have changes in the normal skin pigmentation. But usually those are transient and will resolve spontaneously over the course of a couple of weeks.
And the woman that asked the question, Julia Sams, about why aren't doctors all on the same page? Well, this topic is not covered in medical school, and right now the dermatologists and other laser associations like the ASLMS set the standards, and so since there are no uniform universal guidelines, treatment varies. Do you want to comment on that?
Yes, I mean there certainly is a wide variety in terms of physician training and background. Our group, Roy's group, the group in Boston, I mean, we've been the people that have been doing this the longest, 30 years. There's a lot of misconceptions about when treatment should start, how frequently treatment should be done, how aggressively the treatment should be done. So those are things that hopefully through organizations like the VBF will become increasing physician awareness so that the treatment will in fact become more standard.
Okay, thank you. This again is Dr. Linda of the Vascular Birthmarks Foundation with Dr. Stuart Nelson of the Beckman Laser Institute, and we're on Facebook Live today talking about the treatment of port wine stains and hemangiomas using the various lasers and our combination therapies. Once again, we are having a little bit of a weak connection, so if we lose you again, we'll be right back on. My email address is birthmark.org/Dr. Linda. And for Dr. Nelson, it's birthmark.org/Nelson, L-E-L-N-E-L-S-O-N. Is it true that the PDL is not being effective on Chinese Asian skin?
Well, for the reason that we just discussed, for patients who have darker skin types, there is going to be some epidermal melanin absorption. And so unfortunately, patients who have darker skin phototypes are not going to respond as well to the laser as opposed to Caucasians or patients who have much lighter skin types.
But it can be done.
It can be done, but the treatment, regrettably, is just unfortunately not going to be as effective.
But that's really where you need an expert, someone like Dr. Geronimus, Dr. Nelson. Any new technology or techniques on the horizon for adults with resistant port wine?
Well, the main advance now has been the use of longer pulse durations as well as deeper penetrating wavelengths. For adult patients, consideration can be given to using both the Alexandrite laser, or also for people who have nodules and other skin textural changes, the longer wavelength ND-YAG laser can actually be a treatment option. So there are options for patients who have a resistant port wine stains, but those types of treatments, because the light is penetrating deeper into the skin, you do have the possibility of more adverse side effects such as scabbing and blistering, and so those procedures should be done by people who have got a lot of experience using those devices.
So Danielle is saying, I guess someone who treated said it won't leave bruising. That comes up a lot, so you can...
Bruising is related to the pulse duration of the laser, and when I'm treating families at our institution, their children, I will tell the parent, I'm changing the pulse duration of the laser. Today, your child is going to have more bruising because shorter pulse durations of the laser were used. When you're using long pulse durations or longer pulse durations, particularly when you're treating older children or even adults, you're going to get much less purpura. So the purpura doesn't mean that the laser was successful or unsuccessful. It simply means what pulse duration was used for the laser treatment.
Thank you, Jenny, and others for sharing our video. And someone wants to know who had laser treated early, will it come back?
It is possible that if the port wine stain is very deep in the skin, you may insidiously, over the course of several years, see some recurrence of the port wine stains, at which point that we can then reinstitute treatment.
And someone just asked about the use of a Mickey Mod.
We did a study several years ago with the Mickey Mod. It was a little bit helpful in the short term, but over the long term, we didn't find it particularly helpful. And also, the Mickey Mod was very irritating to the skin, so we haven't been using that concurrently with our pulse dye laser treatments.
And would that be the yellow one she's talking about, a yellow laser or yellow laser?
Well, the yellow light laser is the pulsed dye laser. When I was talking about the Alexandrite and the ND-YAG, the Alexandrite is actually red light. The ND-YAG is actually infrared light. So I'm not sure, Danielle, about which laser you're particularly talking about.
Hi, Scott, from Dr. Nelson and Dr. Linda. Scott Couples. And thank you to everyone who's sharing. And I think we answered your questions, Danielle Stammers. So could we have the next question for Dr. Nelson? Once again, it's Dr. Linda from the Vascular Birthmarks Foundation with Dr. Nelson. Are there more studies being done on topicals to help reduce recurrence?
Well, we're working with a company, and regrettably, I'm under a non-disclosure agreement, so I can't discuss it, but we are working with another company that has developed several anti-angiogenic agents, particularly for the use of treatment of cancer. And hopefully, I'm cautiously optimistic that over the course of sometime this year, we'll be able to actually get one of those agents into a clinical study. So yes.
Okay, and how often on a 4-year-old, her port wine stain is on her face? They treat every 2 to 3 weeks on babies. If we do treatments 2 a year, is it enough?
I would say for a 4-year-old, I would probably be wanting to do the treatments every 2 to 3 months.
You're welcome, Danielle. And, okay, another person asked about research, what's on the horizon.
I'm sorry, I can't see it, Linda.
There was a question that went past about research. What's on the horizon?
That was the one I think I just answered, where I said we're going to be doing a clinical study hopefully later this year using the combined approach.
Yeah,
so I saw that.
Yeah, someone wanted to know who is doing the research. I guess.
Well, it's our group. My group and my fellows who are working with me will be doing this study.
And I know Dr. Geronimus is doing some research as well. And one of our board members is doing his actual dissertation on port wines being treated. So there's a lot of work going on right now about it, and we're very excited to share that with you. Thank you, Jenna and Danielle, for joining our group. We now have 38 people on, so we're looking for more people to post appropriate questions about the laser and its use for treating port wines and hemangiomas.
I'll take a drink.
Okay, and also somebody asked about the combination of a topical. Okay, what is the ideal settings for a 1-month-old with a port wine stain on her face? You're currently doing every 4 weeks, PDL, 9 wavelength, 10 millimeter spot size.
I think what they're referring to is 9
joules.
Is 9 joules. They're
Yeah.
talking about the energy density. And
Yeah.
I typically, for a child that age, probably would be using maybe a little bit less than that, maybe 8.5 joules per centimeter squared, probably with a 1.5 pulse duration and a 10 millimeter spot size. I think that would be a good place to begin, and then titrate that depending upon the response that we see with the child.
Someone asked you what you thought about sirolimus being used for venous malformations.
I'm not aware of sirolimus being used for venous malformations. It's certainly being used for lymphatic malformations, very successfully, by the way, but I am not aware of any good studies on venous malformations.
Our doctor wanted to wait and treat our daughter until she was 1. We decided to look elsewhere and finally going for our first treatment at 18 months. We're in Canada. Our port wine stain is quite light and patchy on lower cheek. You're upset that you didn't start sooner, but you're way ahead of a lot of other parents. And if it's patchy, that's probably going to have a good response. So it's excellent. Can the settings of the laser be too deep so that the superficial capillaries are not targeted?
Well, the light from the pulse dye laser will go up to 2 millimeters into the skin, and it will be absorbed by the first layer of blood that it sees. So this is often the problem in resistant port wine stains, that you've got a very dense network in the superficial layer of the skin, which is blocking the laser light from actually going deeper. So that's the problem. So it's not, the superficial capillaries are definitely going to be targeted with any pulse dye laser treatment.
Midface is more resistant. Is there any research on why?
Well, the reason that we believe is because blood flow through those vessels in the midface is much higher, because many of the blood vessels actually communicate with the brain and are responsible for cooling the brain. And so because the blood flow is higher in those vessels in the midface, that's the reason that we believe that they're more difficult to treat in that location.
Is pulse dye laser successful in all parts of the body?
It's more successful on the upper parts of the body, particularly the face, neck, and upper chest. The laser treatment isn't as successful on the distal part of the extremities, particularly people who have, for example, upper extremity lesions. It will work well on the arm, less well on the forearm, and even less well on the hand.
Chris Lee, I think your question is, you had treatment with Dr. G and you're done, but you're worried about when you should start again.
Well, I would contact Roy's office if you see any evidence of recurrence, and then Roy can restart the treatment and get you back to the great result that you've got.
How do leg port wine stains respond to laser versus face? Chalice.
The leg will respond, but again, because it's the lower part of the body, the response is not going to be as good as a port wine stain on the upper extremity, on the upper trunk, and the face and neck.
And the rule of thumb is the farther away from the heart, the
more distal,
yeah.
or on the extremity,
Yeah.
or the farther away from the heart, or just the more distal part of the extremities, there the port wine stains don't respond as well.
It's on her right ear. Should we worry about any issues inside of her ear?
Well, if it's on the outside, on the pinna, for example, or the helix of the ear, probably not. If the external auditory meatus or the canal is involved, then if the port wine stain becomes thicker over time, you might have problems with airway or ear canal obstruction, and so that's something that should be evaluated by a pediatric otolaryngologist.
Someone said she's 57 years old, and is it okay to start treatment?
Absolutely. We have posted at the Beckman Laser Institute, if you come to our clinic, you'll see a dentist. His name was Bob, who began treatment at age 65 and had an excellent result. So there's no upper age limitation in terms of when you want to start.
If we're not answering, it's because they're coming in too fast. You live in New Zealand, where the sun is strong and unsafe to get it sunburn. Is it unsafe? Will it reverse the work?
It's not going. If you're in New Zealand, it's not going to reverse the work, but if you become tanned, it's going to make the laser treatment less successful.
How do they know when they're in the maintenance phase? Will it ever be completely gone?
Well, I tell families that we'll discuss the maintenance phase if we've seen 3 consecutive treatments where there's been no improvement in the port wine stain in response to the laser.
Which means that's as far as it's going to reach at that time.
Yes.
It's not going to reach. And so the ones that went by, there was one from Jody Lee, and I think 2 women in their 50s both talked about starting treatment. As Dr. Nelson said, there's no age that you can't start treatment. Do you use it to treat deep hemangiomas? And what kind of laser? My niece has a deep hemangioma on the right side of her face. She's been on propranolol for 1 year. She still has it.
Well, as I said, the light from the laser is going to penetrate up to about 2 millimeters into the skin. So if this hemangioma that you're referring to is deeper than that, then the laser probably is not going to be helpful, and you might consider a surgical option.
Okay, so this is someone that has one of the port wines that's faded, and should you have treatment?
Well, if the port wine stain is still present, then I would certainly recommend that the treatment be done.
Oh, somebody wants to know if the numbing cream decreases the chance of clearance. That's the EMLA cream.
Well, the question is always resolved. I mean, the use of topical anesthetics are controversial because one of the ways they work is that they cause vasoconstriction of the blood vessels. And so if you're removing hemoglobin from the blood vessels, which is the target of the laser treatment, when you're using EMLA for port wine stains, it can make the laser treatment less effective. So at least at our clinic, we prefer not to use EMLA, and we'll use local anesthetics or general anesthetics.
Someone who said when they stop treatment, how many do they need to regain the last result?
Usually it will happen quite quickly. I would usually say probably 3 to 5 treatments, and you'll get back to the baseline that you were.
And someone said there's no purpura, so you want to know if that means the laser doesn't work.
Well, again, I think we answered that question earlier. The purpura has to do with the pulse duration of the laser exposure. You can deliberately get purpura by using short pulses of the laser, and you can avoid getting purpura by using longer pulse durations of the laser. So it doesn't mean that the laser treatment's not effective. It just tells you what type of pulse duration was used for the treatment.
And Jenna, yes, you can have port wine stain on the gums, and the gums can thicken. The question is, would you use laser on the gum?
I will not use laser on the upper or the areas where there's teeth involved, because the light from the laser can infarct or destroy the blood supply to the tooth, which can result in death of the tooth. So you can use it on the inner gums or the outer gums of the cheek, but not on the areas of the maxilla or the mandible where you have teeth.
But that tissue can grow, Jenna. Port wine stains on the gums can grow. It can, become more progressive, and the teeth can splay. But Dr. Darrow is on our website, and you can ask him a question about that for Ashton. That's Wong Tony.
Mm-hmm.
Or Tony
Glad
Wong.
to hear Ashton's doing well, Tony. Regards to you and Raylene. I see a question. I live on the East Coast, Pennsylvania. I recommend a specialist near me. I would recommend that you go to New York and see Dr. Geronimus.
Yes, Dr. Roy Geronimus is equivalent in expertise to Dr. Nelson. They're 2 of the top 3 in the world, along with Dr. Anderson. Heather Funk, treating inside the cheek. We've never been told to do it.
We'll do that if the parents request it, since it's not a cosmetically obvious site. Most parents don't ask for that. But if it is of concern to the parent, then we'll go ahead and do that.
Port wine on her face. Melanin will leave a white patch.
I'm sorry, I didn't see the question, Linda.
They said there's a port wine on the face of the child who's pigmented. Will the melanin leave a white patch? You answered it.
Usually the melanin will come back within a couple of months. So usually permanent hypopigmentation where the skin turns completely white will not happen.
I'm sorry, the one from Norway, you'll have to let it go through. They're coming in quick. If it's the port wine is faint and the laser isn't lightening it,
Well, it still will
cobble.
prevent the cobblestoning, and it will
Yes.
still prevent the nodules. So yes,
Yes.
using the laser for that situation
Asian
will help.
skin Filipinos successfully lightened it.
Sure,
Yes.
we have living here in Southern California. We have lots of Asian patients, and they do well. But because of their absorption by epidermal melanin, particularly in those Asians who have darker skin types, the laser isn't going to be as successful. But we have many patients who are Asian in Southern California who we've treated successfully.
Someone asked about treating a port wine. Will it decrease the ability to grow facial hair?
Yes, because melanin in the hair follicles will absorb the light, so you can get permanent damage to the hair follicles. The best statistics we have are about a 20% reduction in the hair density if repeated pulse dye laser treatments are done.
Scalp of a 21-month-old, and then the one who had scarring, please resubmit your question, but the 21-month-old.
I'm sorry, I didn't see the 20. The
I live
questions
in
are going back so quickly.
Colorado. Should I travel for treatment, or do you recommend a doctor in Denver?
I don't know anybody off the top of my head. Actually, in Colorado, I know Dr. Joseph Morelli was doing treatments there, but I'm not sure if he is still active. We actually have a lot of patients from Colorado who come to Southern California to see us.
A 16-month-old is seeing a dermatologist this Wednesday. Is it too late to start topical treatment? No, not at 16 months. But, you know, depending on how much it's raised, it can be the size of a quarter, but if it's more than 1 or 2 millimeters, the topical is not going to penetrate.
I would not recommend using topical timolol or oral propranolol.
So he said, I know we cut out because of our poor connection.
Did I answer your question, Jillian? If I didn't, just please resubmit it, because we went out for a minute.
Yeah, she wanted to know about it. If it was 16 months is too late.
16 months is not too late, but just the question is the hemangioma still in the proliferative phase, in which case the medications will be helpful. If it's not, then the hemangioma will not be adequately treated by those medications.
Oh, Jody says Dr. Morelli will only use the 585.
So we're fortunate at our institution, we do have access to other devices.
So Shalise wants to know, if they travel to see you, do they need to stay for a few days? They can leave right
No,
after
usually the patients that come to us from around the West Coast and Colorado, Texas, will go back to their residence and their state of origin, after the laser treatment that afternoon.
Okay, so Dr.
Morelli still is active. All right, thank you, Kiana.
Kiana, yep, Barbara, yep, thank you, Kiana. So the ones that we missed, please, if we didn't, mention your question, because they're coming through pretty quick. Jillian, okay, thank you. Her hemangioma has changed color, getting darker and somewhat cloudy. So then it's probably done proliferating.
Well, if it's done proliferating, then you can consider certainly using the pulse dye laser will be helpful to remove that redness.
Does taking 6 months off in between reverse any of the success?
It depends on what sort of phase the port wine stain is going to be in. I mean, 6 month delay probably is probably not going to change things much. So, I wouldn't worry if you said you're in the military and you're moving to another state. I wouldn't worry about that.
So, someone wants to know anybody in Europe that you could recommend.
Michael Lonthaler in Germany certainly is a very highly respected port wine stain surgeon. Christine Diericks in Belgium. Also, I can very highly recommend Dr. Chantal van der Horst, who is at the Academic Medical Center in Amsterdam. Those would probably be 3 people in Europe that I would very highly recommend.
Is there a specific laser that needs to be used for the treatment of a port wine stain on a lip?
No, we use the pulse dye laser. We'll go over the vermilion border, which is the junction between normal skin and the lip, and we'll treat right on the lip.
Someone wants to know if they should stop treatment in the summer. They live in Arizona.
Well, if their children is going to be exposed to lots of ultraviolet light and become tanned, then yes, I would recommend you stop the treatment during the sun.
And Gustavo came to the U.S. and started a organization to help people with birthmark treatment. So a shout out to you. Kristen Lee, can you have treatment on the face while pregnant?
Sure. I mean, the light from the laser is not going to affect any issues with pregnancy, but you're correct in the latter part of your question that because of the hormonal influences of the pregnancy, the port wine stain will probably become darker while you're pregnant.
Yes, Dr. Nelson did say the gums can be treated, Jenny.
On the inside of the cheek, but not on the areas next to the teeth. Because you have to be concerned about destroying the blood supply to the teeth. So we don't treat right above or below the teeth.
A laser expert from D.C.?
Probably for children, probably Dr. Iris Rubin, who's at the National Children's Hospital, would be somebody in Washington, D.C., who was trained in Boston by Dr. Anderson.
And again, you'll see one of our staff is posting Dr. Nelson's email at birthmark.org/Nelson, so you can repeat questions to him. What can you tell us about the study done with RF, radio frequency?
Well, the concept
with distal areas
of using the radio frequency is still very early. The device has only been used in adults with resistant port wine stains, so it's not something that's being done routinely for infants and young children.
Kelly wants to know if her child can go into a swimming pool right after treatment.
As long as there's been no scabbing or blistering right after the treatment, and as long as that pool is inside and they're not being exposed to ultraviolet light exposure, sure, they can go swimming.
So Rhonda, she asked this question before, we didn't see it. She had traumatic experience in Oklahoma and has scar tissue. So do you know anybody in the Oklahoma area?
I don't know anybody in Oklahoma, Rhonda, but I can certainly highly recommend Dr. John Burns, who's in Dallas, who's probably the closest person to you.
Sunscreen recommendations from John Lee. He wants to know.
I will tell patients to get a transparent zinc oxide that blocks all the visible as well as all of ultraviolet light exposures. You can buy that here in California at your local Walmarts. You can also go onto the internet and buy it at www.totalblock.com.
Catherine wants to know if getting a tan while receiving treatments is good or bad. Will it reverse the progress, or is it unsafe?
It's not particularly unsafe, but it's going to make the laser treatment less effective because the epidermal melanin layer is above the layer of blood vessels in the skin. And so when somebody's very tanned, basically you're putting an optical shield into the skin, which will block the laser light from going deeper into the skin.
If a port wine stain is on the leg, Shalise wants to know what is the likelihood of KT?
Well, it depends on how much of the port wine stain is involving the leg. If the entire extremity is involved, then the likelihood of Klippel-Trenaunay syndrome becomes increasingly higher. And so if there is concern about that, then I think you need to have a magnetic resonance angiogram ordered on your child to rule out the possibility of underlying Klippel-Trenaunay syndrome.
Jenny wants to know if you can't treat the gums and there's hypertrophy, should she consider surgery? Yes, but you can also talk to Dr. David Darrow on our Ask the Expert on birthmark.org about dental issues.
But there are other lasers that can be used to treat the gums. We don't want to use the yellow devices because they'll destroy the blood supply, but certainly you can use the carbon dioxide laser to plane down the hypertrophy that you get of the upper gums, and that's not going to be safe.
Waiting until age 2 has...
I'm sorry, I can't see it.
If someone's 2 years of age and it has significantly faded without treatment, we can only get the laser under GA in Ireland.
I'm sorry, I can't see the top of the question.
All right, Dr. Rubin from D.C. only does laser for my daughter once a year.
Well, I'm a little surprised to hear that. I mean, we, as I said, at our institution as well as Roy in New York, we treat infants and young children as early and as aggressively as possible every 4 weeks. So depending on the age of your child, Laurel, I hope I'm pronouncing your name. Is it Laurel, LorYll? I hope I'm pronouncing it right. But you might consider going up to New York then to see Roy.
Dr. Geronimus at the Laser Institute in New York. Can I have a time check, Dr. Nelson?
4:39.
4:39, okay. We just need to keep track of our time. We will go over a little bit because we got on late. I'm nervous to use anesthesia.
Well, the anesthetic that we use here in Irvine is sevoflurane, which has a very fast onset and a very fast offset. It's highly safe for infants and young children, so I would not be concerned about having your child put under general anesthetic.
The person who's seeing Dr. Garner and is looking for closer treatment, you're not going to get anybody there any better than Dr. Garner. I would stay with Dr. Jerry Garner. He's one of the best in the country. He's excellent. And we missed another one. Hello. Okay, Mimi. Hi, Mimi. updates on the new angiogenesis inhibitor.
Well, we're working on that. I actually have a teleconference later this month with the company to discuss a clinical protocol. And as I said earlier, I'm cautiously optimistic that we'll be able to get that study started before the end of the year.
Oh, so David said the port wine is significantly faded by 8 months. Would you wait to age 2 before you thought about treatment? I would agree to wait.
Yeah, if it's spontaneously on its own.
Yeah.
I mean, it might not be a port wine stain. It might be an involuting congenital hemangioma, which is sort of masquerading as a port wine stain. So yes, wait.
Okay, so I guess that Dr. said she's not used to treating Asian skin. Well, Dr. Geronimus and Dr. Nelson and Dr. Rox Anderson all treat pigmented skin. They're the 3 in the country that are comfortable treating it. What medication did you say was used for general anesthesia?
Sevoflurane.
Sevoflurane. How frequently do you do GA for a 21-month? And by the way, there was a study on our website that said there were no adverse effects from multiple anesthesias in pediatrics getting laser treatment for port wine. That study was done by Dr. Geronimus. That's on our website. How frequently would you use general anesthesia for a 21-month?
Probably every other month, I would say. Probably every 6 to 8 weeks.
Every 6 to 8 weeks. Will treatment be painful for crawling or walking if stain is on the leg?
Usually not. I mean, infants and young children are remarkably resistant. So as long as there's been no scabbing or blistering chalice, it shouldn't cause any problems on the extremity.
Would getting treatment on every 6 months be effective? My daughter has been on the schedule. I guess you have to see.
If you're talking a maintenance treatment, then every 6 months, probably will be helpful. But without looking at your child or knowing anything about their age, that's difficult for me to answer.
After how many treatments is it recommended to take a longer break to see the full effect? 4 weeks is not long enough. Oh, to see the full healing, she's saying.
Well, sometimes you
Dana.
can, Dana, actually you can get it almost like an irritant dermatitis because you're treating these children so frequently, the skin becomes inflamed. And so sometimes it's not a bad idea to take a break for 3 to 4 months to just sort of allow the skin to heal completely.
Mimi wants to know if you combine any lasers with, especially with a stubborn port wine stain.
We often will use the Alexandrite laser, which will penetrate much deeper into the skin as opposed to the pulse dye laser.
So someone wants to know if there's any such studies or psychological effects from having the laser without general anesthesia.
Not that I am aware of, but certainly we've seen many children who have been very traumatized because they have not had general anesthesia. And when I walk into the room, they cry spontaneously, hopefully not because of me, but just because they think that they're going to have a treatment. So we use general anesthesia actually very liberally at our institution because we have the facility right in the building. We can easily do it.
Someone wants a recommendation because they're having eczema on their port wine.
Well, you can treat it with a topical steroid. Usually I'll ask patients to purchase initially over-the-counter 1% hydrocortisone. Thereafter, if that doesn't help, then you can consider going up to hydrocortisone butyrate and gradually, slowly increasing the strength of the steroid.
Marissa wants to know about treating the port wine stain with the laser on the upper lip will affect the ability to breast or bottle feed.
No, it shouldn't. You can certainly go ahead and do that on the upper lip, provided that you're careful and that you don't get any scabbing or any blistering as a result of doing the treatment.
Lauren wants to know how you determine the pulse duration when treating the lip and the settings for this.
Well, typically for infants and young children, I will start with a 1.5 millisecond pulse duration, and then depending on the response that I receive, we'll change it accordingly.
And a couple went by really, really fast, so if we did not answer your question, please circulate it back through again. Lindsay, is the Anderson laser covered by insurance, or is it considered experimental?
I'm not sure what you mean by the Anderson laser. Can you please clarify that, Lindsay?
Lindsay Better Northrop, we're not sure of what that laser is. Okay, we have done 10 treatments and happy with the result, but it's not disappeared. Can we stop or better to continue? Chris Lee.
I would recommend that you at least continue with the maintenance treatment being done at least every 4 to 6 months so that you don't revert back to a situation where the port wine stain has slowly recurred.
4 months has a port wine from her bottom to her toes, down her left leg. Our specialist here in Australia refusing treatment till 3. Her leg is showing signs of being smaller and shorter. By the way, the definition of KTS is either muscle, bone, and skin involvement, and the leg can be thinner or bigger. So that may have a diagnosis of KTS. Emma, you might want to research Klippel-Trenaunay syndrome. And as far as treatment goes, if you want to address that.
The first thing you need to do, Emma, is you need to talk to your pediatrician about ordering a magnetic resonance angiogram of your child's lower extremity to rule in or rule out a diagnosis of Klippel-Trenaunay syndrome.
Alexandrite label may be what they were referring to.
Okay, then I know Roxanne.
Alexandrite.
Yeah, Alexandrite. I think you're probably right, Jody. So certainly you can use that device, particularly for adults who've got thicker resistant port wine stains.
But is there a laser that Dr. Anderson's working on?
Not to my knowledge. I think Jody's right. It probably was the Alexandrite.
Alexandrite. Okay. Yep. Alrighty. So again, those of you whose question went by because we got so many so quick and they just breeze right past us. If we did not answer you, send it through. What effects should we expect? Said Kelly, when our daughter hits puberty, is it guaranteed that the port wine will thicken due to hormonal?
It's not guaranteed, but it's not uncommon to see darkening of a port wine stain when a child is going through puberty. But if you're having pulse dye laser treatments and you're maintaining it with the pulse dye laser, you shouldn't worry about any nodularity or hypertrophy.
Somebody said go Ducks.
That's Jacqueline Mazzani. Hopefully they're winning, or they'll win.
She wants to know about a cough that lingers after laser treatment from anesthesia, and then some of these are just going by too fast.
Well,
My daughter has not used Genesis. Okay, go ahead.
I mean, some children can get a little upper respiratory irritation from having, general anesthesia, particularly at this time of the year where everybody has a cold and a stuffy nose, including me. So if you're concerned about that cough, you should have the child seen by your pediatrician.
So Catherine's daughter's had 13, and she's 21 and recognizes the doctor and cries. So she's worried. So she's, I guess, saying, is now the time to switch to anesthesia at 13 months?
Absolutely, Catherine. I mean, I would not have waited till she was 21 months of age. I mean, what you're reporting is what I described earlier, where patients, the children just become so traumatized. That's why we use the anesthesia liberally.
Yeah, Shalise wants to know, do they need the test for KTS, or can they see you for treatment without the test?
Well, I would order the KT. I would order the test for KT before starting the laser treatment.
Can the PDL affect a possible underlying AVM?
AVMs need to be treated by embolization and surgery. The pulse dye laser is not going to successfully treat an arteriovenous malformation.
Okay, someone's daughter was since she was 1 month and until she was 3, she's 5, and now it's coming back on her frontal and right eyebrows. Do we need to go back to laser treatment?
Yes, absolutely, so that your daughter can be returned to a good treatment result and not have the port wine stain come back completely.
And the ones that went by that we didn't ask, do vascular go away? Is there any chance? The research says that the best you can get is 90% resolution on, I think it's 20%.
Yeah. Well, you need to tell us, I'm not sure how to pronounce.
On the tongue, lip.
On the tongue, lip, what type of vascular malformation. Is this a venous malformation? Is it a lymphatic malformation? Is it an arteriovenous malformation?
Catherine wants to know if maintenance every 4 to 5 months is necessary for the rest of her daughter's life.
As we sit here, circa March 2017, yes, probably your child may need to have maintenance treatments.
Oh, they want to know if it'll hurt the AVM.
It's not going to hurt the AVM, but the question is, how effective will the laser be for an arteriovenous malformation? And in my experience, I have not found them to be helpful.
Does the laser treatment of the lips prevent hypertrophy?
It can certainly prevent that, but some patients, if the lips, because they are very vascular, they may still get the hypertrophy despite the use of the laser, and they may have to consider lip reduction surgery later on.
Chalise once says there's diaper rash on the side with the port wine. She uses beeswax. Should she use something else?
I would probably recommend you use over-the-counter 1% hydrocortisone, and if that isn't helpful, then talk to your pediatrician about using hydrocortisone butyrate, which you'll need a prescription for.
Justball wants to know if lasers help reduce soft tissue hypertrophy.
It will help prevent the soft tissue hypertrophy, but once the hypertrophy is there, then the laser isn't going to be as helpful.
Brianne Riley says,
hi, Riley.
Miss
Fran,
seeing you.
Say hi to John and the 3 kids.
Miss seeing you, Dr. Nelson. Mimi, does the color to the lip eventually return after PDL?
I mean, to completely normal, that's hard to say, Mimi. I mean, again, port wine stains that involve the central face, those are more difficult to treat. So it's impossible to tell whether somebody's going to have a completely normal result on their lip afterwards.
Venous malformation. She had 7 YAG. She is 7 years old now. Would it return with hormone changes?
It probably
Typically.
any hormonal changes, pregnancy, puberty, the venous malformations will get worse. If she's been treated just with the YAG laser, you might talk to your physicians about possibly doing scleral therapy, particularly by an interventional radiologist. That may be a better way to approach your daughter's venous malformation than YAG laser.
Lindsay wants to know, she said her son is 10, has been treated with the PDL, and said you mentioned another one, another laser. I think you were talking about
I was probably talking about the Alexandrite laser.
Yeah.
Jeff Waltz, I'm firing off answers like a Wild West gunslinger.
Well,
I'm just trying to answer as many.
They're coming
scrolling
through. They're coming through like Wild West gunslingers.
And I'm probably going
Rapid
like this,
fire.
like an idiot, trying to read as it scrolls by.
We're doing the best we can. So if we haven't answered your question, we're going to stay on a few minutes extra because we got started with our poor connection a little late, but please bring your questions in. Kelly, we're doing treatment every 2 weeks, traveling to New York City.
From Norway, treated
four times a
see
year.
it.
Is
That
there
was
a
one that
doc
went
you
by.
recommend? And that's another one in Arizona. No, people in Arizona go to Dr. Nelson. We are heard to always cover that with sunscreen when the child is outside. How soon should you apply that versus Vaseline?
Well, I'll tell people to wait about 1 to 2 weeks, at least until the purpur is resolved after their laser treatment. Then you can start using the sunscreen again.
Lindsay wants to know if the Alexandrite is covered by insurance.
Well, it's the Alexandrite laser was actually developed for laser-assisted hair removal, so it just is incumbent on your physician to write a good letter so that they can get that authorized for you.
The Maddox family says hello.
Hi, Allison and Ben. Give my regards to Carson and the rest of the children.
Thank you,
Jeremy
Jeremy.
Hargrove.
Thank you.
Hi, Jerry.
Thank you, Jeremy.
Say hi to Reese and Carrie.
And so once again, we'll be going a few minutes over, but just to get in touch with Dr. Nelson, it's birthmark.org/Dr. Nelson. And for me, it's birthmark.org/Dr. Linda. Pendergrass wants to know, does general anesthesia make it harder to see the port wine stain?
No, if anything, it makes it easier because once the child's asleep, you can put the patient in Trendelenburg, which means you put their head down so you can actually fill up the port wine stain. So it actually makes it easier to do the laser treatment.
Well, and I had talked about that once. For doctors that don't do the technique Dr. Nelson just mentioned, it can fade out in the OR if the room is cold, if they don't do that. Correct? Dr. Nelson?
Hi, Amanda and Reese. So give my regards to Jeremy, too.
When using GA, is laser more expensive?
Oh, I didn't see the top. That question scrolled by
These
too
are going
quickly.
by really fast. Sorry. 12-year-old is resuming treatment.
Yes, definitely use
GA.
general.
Yes.
Definitely use general anesthesia.
What are your typical amounts?
For a V2 dermatomal distribution, typically I would start with a pulse duration of 1.5 to 3 milliseconds, and with an energy density of 8.5 to 10 joules per centimeter squared.
Should the surgeon have experience with a port wine stain on the lips in order to do lip reduction? Yes.
Yes,
absolutely.
I mean it needs to be done by a facial plastic surgeon
That
who's experienced in
understands
treating
it.
these
Yes,
patients.
yes.
So no, not just a regular
And
plastic
we have
surgeon.
recommendations, Amanda, from the Vascular Birthmark Foundation for surgeons who are familiar with debulking a vascular lip. Okay, and then again, some were really going by really fast. Some people are, taking, it's just, you're going to have to submit it again. Do you think fewer treatments will be needed? Meredith wants to know what future technologies. Well, we're hoping.
We're hoping. I mean, we're working to develop lasers which will penetrate more deeper into the skin. So yes, I think later, subsequently, as we go through this, we will be seeing devices that are more effective.
Is it general anesthesia? Is it more expensive? Well,
of course
yes.
It is, because you now have an anesthesiologist, you have an operating room, you have a recovery room charge. So yes, the fee is going to be higher. That's going to be billed to your insurance company.
You had her with our new in UN's Chapel Hill, and he missed half of our daughter's cheek.
Well, what we do, Heather, is that we'll have our anesthesiologist put the head of the bed down, so it's in a dependent position. Therefore, there's more blood in the head at the time you do the laser treatment, so it makes it easier for the treating physician to see the port wine stain birthmark.
Jeff says that his 1-year-old had 7 treatments and that the chin isn't responding as well as the rest.
Well,
which is typical.
That is typical, Jeff, just because, as I said, the more central facial port wine stains are more difficult to treat. So your physician is slowly going to have to increase the energy as well as use longer pulses of the laser to get those areas which are more resistant.
What age do you suggest doing it without anesthesia?
I leave that up to the parent, but certainly most of the children that we're doing, I would not do somebody probably less than certainly maybe 13, 14, 15 without anesthesia. I just find it's too traumatic for the child. You can do it with local anesthetics by injecting and doing regional blocks, but those are often very, very painful, and so I probably would use anesthesia up until the children are about 14, 15 years of age.
Laurel, we're posting his phone number and his email several times in this. You can scroll through and see it. It's birthmark.org / Dr. Nelson. If insurance doesn't cover, any recommendations on how to get treatment? Well, Shalice, at our conference in New York City every other year, Dr. Geronimus does one for free, and we can negotiate a rate with him because he's in private practice. I don't know what arrangements Dr. Nelson can make if your insurance won't cover.
Meredith's asking if this is being archived. I think it is, isn't it?
Yes, it'll be available, so you can go back and listen to everything. It's indefinitely up on the VBF website and on our Vascular Birthmarks Foundation Facebook page.
Hi, Meredith. Say hi to Sal. I hope he's doing well, and also my regards to Christian.
Catherine wants to know if you see children frightened when they have GA as well.
It depends on the age of the child, whether or not they need to have the IV. For most of our infants and young children, we don't put an IV in. We simply mask the child. And so having an IV really isn't an issue because, as I said, most of our children don't have IVs.
Chris wants to know if the laser is painful.
It can be, depending on the anatomic site that's being treated. Certainly areas in the central face, around the eye, on the upper lip, those are more painful sites.
Thank you, Missy, for staying here with us on this session and giving out the information that people needs. Jeff Chrisley, our 1-year-old, bounces back. Okay,
so
before we leave the hospital. All kids are different. They all react different. And when you hear Dr. Geronimus next month, you'll all hear a completely different approach to treating without anesthesia. So that's why VBF has all the different experts on giving expert opinions, and every 3 to 4 weeks we will be having Facebook Live sessions with other experts. Okay, so what time? Can we have a time check?
4:56.
All righty. We will be going another 10 minutes, and then we'll have to wrap it up. So we will go until 5:10. If it's a mask for GE, general anesthesia, does it get in the way for treating?
No, the anesthesiologist removes the mask while we're doing the laser treatment. Hi, Aaron. Give my regards to Sydney. I'm looking forward to seeing you next week.
We haven't seen anyone yet, and your daughter will be 6 months. Is this considered late?
No, just the earlier the better, but 6 months is not late enough. Certainly
No.
go ahead and start the treatment.
But I think Chalice is one of the ones from outside the USA. But you mentioned some doctors from Europe, so. Okay, so we've got 10 more minutes that we'll be taking your questions. Sorry for losing and having a weak connection every now and then. Once again, this is the Vascular Birthmarks Foundation's Facebook Live session with Dr. Stuart Nelson and Dr. Linda. I apologize for the technical difficulties. We know now to be in a place where we have good Wi-Fi. So we just had one about how many treatments those few that just went by really, really fast. Laser versus physical excision, what are your views of each?
Well, the physical excision is going to leave a scar, so certainly if it's a very small area and you're willing to have a scar, then it's okay, to do that if it's a lesion that's small enough and amenable to surgical excision.
Chris wants to know if it's traumatic if a baby cries during treatment. I wouldn't say that crying would.
Well, a lot of times if it's around the eye, you're putting an eye shield into the eye, so that's going to cause the child to cry. So normally what I do with the infants is I'll tell the parent to starve the child for about 1.5 to 2 hours before the treatment so that I return the child. We then feed the child and the child will calm down.
So Liz has had 17 treatments and feels like it's come to a halt. I say if there's 2 or more subsequent with no additional clearance interference,
I can't see the question.
they should discontinue. I just told you it.
I'm trying to read it.
They're seeing no improvement after some subsequent treatments. I say discontinue for a while. What should I expect for my 6-year-old getting her first treatment under GA?
It's expected to go well. I mean, the treatment should be painless. There should be no problems. Your child should recover very uneventfully.
And the questions that went by that we missed, please ask them again. Congratulations, this is your most commented on video yet. There you go. The Weiss family, will see you in June.
Well, looking forward to meeting your family, Shelley.
Sun Classic is considered lighter, patchy, and fleshy, has had 9 treatments for 13 months. Minimal lightening. Any advice? And they're from Texas.
Well, just continue with the treatment in Texas because, as I said, you want to treat these lesions as early and aggressively as possible so that you can get the maximum clearance.
Scott wants to know, for an adult who has thickening and he did have some blebs and Roy's been treating him, what kind of result can he expect if he continues with treatment?
Well, you'll be able to flatten out and smoothen out all those vascular nodules, but probably the hypertrophy that you've already got is not going to be reversed using the laser.
Do you treat inside the cheek and the gum, and the lip, I mean?
Yes, we can certainly treat inside the cheek and inside the lip, but as I said earlier, not on the areas where teeth are involved because you can actually injure the blood supply to the teeth.
Well, we'll mention the Europe doctors in a minute, but the 6-year-old son had extreme pain urinating. The malformation is in the penile area. San Diego won't touch it.
Well, we need a diagnosis, Aaron. So presumably your child has had some kind of a magnetic resonance angiogram or some kind of an imaging study. But if you're going to Rady Children's next week, your child will probably be either evaluated by either Dr. Sheila Fallon Friedlander or Dr. Eichenfeld, Larry Eichenfeld. So you're in excellent hands.
Yes, they're both excellent. Inner lip area from Mimi Anderson.
Certainly do treat on the inside of the lip. That's fine.
Yes. How many treatments to notice results? Well, they all vary.
They all vary, but I mean, certainly it's probably going to take at least 3 to 4 treatments before you're going to see significant fading on the lip.
If that was pertaining to the lip. Would you spell the name of the anesthetic that you use?
Sevoflurane, Sevoflurane.
Oh, somebody's had lymphatic involvement. Okay, my daughter has had treatment over her eyelid and it is still red, puffy and flaky. Last treatment was June of last year. Why?
Well, if it was 8 months ago, you need to go take your child in and see the physician who did the treatment. I mean, if you're saying it's puffy and flaky, she may have a little bit of eczema on her upper eyelid. About 30% of children will have eczema in association with their port wine stains. So I would recommend that you take the child in to see your pediatrician and possibly place that child on some topical steroid.
And make good travel plans and arrangements. Okay, Dr. Nelson and Linda, we just want to say thank you. You're welcome, Megan.
Hi, Megan. I think Kensington's actually coming in to see me tomorrow.
Yep. So she'll be seeing you. And I'm here, Megan, in California with Dr. Nelson.
You were the one that referred this family to me. They called right before the conference, I think 4 years ago or 3 years ago. So you actually have met the Kensington Flynn family.
And everybody, just so you know, you can see Dr. Nelson for free and get a free clinic evaluation at our conference on October 7th at the UC Irvine Medical Center, at the Island Hotel, and the Beckman Laser Institute. You can go to birthmark.org to find out about that. Port wine stain on the cheek always has edema. They want to know if that's lymphatic.
Well, the only way to make that diagnosis, Nancy, is to order a magnetic resonance imaging study of the cheek to see if there is an underlying either venous or lymphatic component to that port wine stain.
And Jeff is saying they vary between laser or anesthesia and no anesthesia, and he's had 7 treatments.
Well, he says sometimes he gets an IV. That may, when you're talking about a 1-year-old getting an IV, I would probably suspect they're concerned about nausea and vomiting. If we are concerned about that, we'll put the IV in after the child is asleep. But if the family tells us that the child has had problems with recurrent vomiting, then we'll put an IV in, and that may be the reason that you're using the IVs.
Alicia wants to know, what are the optimal laser settings? We're not seeing results after 9 treatments.
Well, I think you need to sit and review with your physician exactly what pulse durations and energy densities have been used, and then they can make a determination about whether or not some of those parameters should be changed to maximize the clearance.
Yes, Catherine Elizabeth, yes, when you email Dr. Nelson at birthmark.org/Nelson, he'll refer you to be able to get scheduled, and she wants to know how long it take before she can get in to see you.
No, next week, certainly.
So
next
there you
week.
go.
Do you treat non-involuting congenital hemangioma? Yes. I mean, we certainly can do that if it's a cosmetic concern to the family. Those lesions tend to be quite resistant to the laser. So depending on the location, how thick the hemangioma is, will dictate that, but we certainly do treat those lesions.
So Shalise, just so you know, if you come to the conference in October, you'll get the consultation for free. Otherwise, you'll have to call his staff to find out how to schedule the consultation.
If you're interested in coming in earlier, Shalise, contact the BLI Ambulatory Practice Manager, Andrea Giancarli, and her contact information is available on the BLI website at www.bli.uci.edu.
So Alicia, the treatments that are for free that are at the New York conference, which is during the even years, are not done under anesthesia. We have yet to get approval to have them done in California, but we're working on it.
Yes, we are. We met up with the powers that be at our
My son has
site.
had 2 surgeries on a vascular anomaly. It's under his upper lip when he was young. Now he's in his 30s. It's come back gradually.
Well, we need to know what the diagnosis was, Jean. Is this a venous malformation? Is it a lymphatic malformation?
Or
Is it an
hypertrophy
arterial
from
venous
a port
malformation?
wine.
Well, she says it's a vascular
Okay,
malformation.
well,
So
that could be
I'm not
port
sure.
wine. What is the recommended time for a baby should be on Atenol before trying something else?
Well, when you say atenolol, usually I think you're probably referring to topical timolol.
Or no, beta, and it could be an oral beta blocker because
Okay.
they're giving that. Canada uses it a lot, pretty successfully. So we're winding down. We have 5 more minutes, and then we're going to have to wrap it up. So if you want to repeat your question, if we didn't answer it, please have it go through again. The question at the Atenol or atenolol, that's another form of a beta blocker, and it is used orally successfully. But again, the guidelines on the VBF website are at birthmark.org are published by the American Academy of Pediatrics for how to treat an infantile hemangioma, and it has dosing instructions for the various beta blockers. So you can go and look at that there. Chilies, you heard it's very common for port wine stains to be misdiagnosed. All vascular birthmarks are misdiagnosed at the rate of 25%, 1 in 4. So should propranolol be discontinued before laser on a bearded hemangioma?
No, we use these treatments concurrently. So Roy's group has actually shown that the use of the combined beta blocker and laser will actually reduce the time that the child needs to be on the beta blocker by about 50%. So they should not stop the propranolol. They should treat the hemangioma with the laser and do those concurrently.
So we're going to be taking 2 or 3 more questions. Thoughts on using lidocaine cream before treatment? 32-year-old. Lidocaine before pulse dye treatment.
I wouldn't use the lidocaine treatment. I would use a lidocaine injection because I would be concerned about possibly removing the target from the port wine stain.
And Chris Lee, if the port wine is gone on no, do not treat if there's nothing there to treat.
If there's nothing there to treat, then don't treat it.
But Chris, make sure if I have a picture and email it to me because I'm collecting data on port wine stains that are fading by 50% or more with no treatment. So please make sure I have the pictures of the baby with your consent. Two more questions and then we're going to wrap it up. It's 5:07. So let us take a couple more quick questions and then we're going to have to finish. Dr. Nelson will be back with me possibly in April and in May. Also, Dr. Roy Geronimus, who has a different approach but is a very successful laser expert, as good as Dr. Nelson, as good as they get, will be with me on March 31st as a Facebook Live. But then I will be back in California with Dr. Nelson, so stay tuned for another one. Okay, so let's do one more question, and thank you again, Missy, for posting how people can reach me and for how they can reach Dr. Nelson. Also, they can register for the conference in October at the Beckman Laser Institute. Mimi's got one more question. A dermatologist trialed sirolimus years ago on adults with no results, but she feels it has helped her 16-year-old babies. There's no.
We're not using sirolimus at all, and certainly not on infants and young children.
I think, yeah, we addressed that too. There's no studies in the U.S. on that. It disappeared with treatment. Oh, okay.
This is somebody saying they're going to
Okay.
send you the pictures. You already
Okay,
did.
yes, and I've got the two. Thank you, Chris. Thank you to you and your wife. All right, everybody. Well, we want to thank you all for this session. I hope it was informative. And remember, you can go back and listen to it. Write down the names of the treatments and the drugs that Dr. Nelson mentioned. And Jean, whether the laser will help a vascular anomaly depends on what type it is, because vascular anomalies can be hemangiomas, port wines, venous, many different things. And what does it mean to the laser to keep the port wine stain healthy? The more you laser, the lighter it will get. And I mean, that may be what they're talking about. So anyways, on behalf of the Vascular Birthmarks Foundation, I'd like to thank you all. Dr. Nelson, would you like to sign off?
Have a good night, and I look forward to interacting with as many of you as possible at the conference in Irvine in October. Good night.